High blood pressure plays a contributing role in more than 15% of deaths in the United States, according to a Harvard study. Although it causes no symptoms, high blood pressure boosts the risks of leading killers such as heart attack and stroke, as well as aneurysms, cognitive decline, and kidney failure. 28% of Americans have high blood pressure and don't know it, according to the American Heart Association. If you haven't had yours checked in 2 years, see a doctor. While medication can lower blood pressure, it may cause side effects such as leg cramps, dizziness, and insomnia. Fortunately, most people can bring down their blood pressure naturally without medication with home remedies for low blood pressure, called hypotension. First, get to a healthy weight. Then try these strategies to reduce the risk of heart disease. 1. Go for power walks. Hypertensive patients who went for fitness walks at a brisk pace lowered pressure by almost 8 mmHg over 6 mmHg. Exercise helps the heart use oxygen more efficiently, so it doesn't work as hard to pump blood. 2. Breathe deeply. Slow breathing and meditative practices such as Qigong, yoga, and Tai Chi decrease stress hormones, which elevate renin, a kidney enzyme that raises blood pressure. Try 5 minutes in the morning and at night for low blood pressure. Inhale deeply and expand your belly. Exhale and release all of your tension. Relieve tension.
3. Pick potatoes. Loading up on potassium-rich fruits and vegetables is an important part of any blood pressure lowering program, says Linda Van Horn, Ph.D., R.D., a professor of preventive medicine at Northwestern University Feinberg School of Medicine. Aim for 2,000 to 4,000 milligrams of potassium a day, she says. Top sources of potassium-rich produce to achieve low blood pressure include sweet potatoes, tomatoes, orange juice, potatoes, bananas, kidney beans, peas, cantaloupe, honeydew melon, and dried fruits such as prunes and raisins. 4. Be salt smart. Certain groups of people, the elderly, African Americans, and those with a family history of high blood pressure are more likely than others to have blood pressure that's particularly salt or sodium sensitive. But because there's no way to tell whether any one individual is sodium sensitive, everyone should lower sodium intake, says Eva Barzenbach, Ph.D., a research nutritionist at the National Heart, Lung, and Blood Institute. How far? To 1,500 milligrams daily if you want low blood pressure, about half the average American intake, she says. Half a teaspoon of salt contains about 1,200 milligrams of sodium. Cutting sodium means more than going easy on the salt shaker, which contributes just 15% of the sodium in the typical American diet. Watch for sodium in processed foods, a Barzenbach warns. That's where most of the sodium in your diet comes from, she says. Season foods with spices, herbs, lemon, and salt-free seasoning blends. 5. Take a supplement. In a review of 12 studies, researchers found that coenzyme Q10 reduced blood pressure by up to 17 mmHg over 10 mmHg. The antioxidant, required for energy production, dilates blood vessels. Ask your doctor about taking a 60 to 100 mg supplement up to 3 times a day for low blood pressure. 6. Drink a little alcohol. According to a review of 15 studies, the less you drink, the lower your blood pressure will drop to a point. A study of Wom. Seven. Work a bit less. Putting in more than 41 hours per week at the office raises your risk of hypertension by 15%, according to a University of California, Irvine, study of 24,205 California residents. Doing overtime makes it hard to exercise and eat healthy, says Hai Yang, PhD, the lead researcher. It may be difficult to clock out super early in today's tough economic times, but try to leave at a decent hour so you can go to the gym or cook a healthy meal as often as possible for low blood pressure. Follow these tips to make your weekend stress-free. Set an end-of-day message on your computer as a reminder to turn it off and go home. 8. Relax with music. Need to bring down your blood pressure a bit more than medication or lifestyle changes can do alone. The right tunes can help you get low blood pressure, according to researchers at the University of Florence in Italy. They asked 28 adults who were already taking hypertension medication to listen to soothing classical, Celtic, or Indian music for 30 minutes daily while breathing slowly. After a week, the listeners had lowered their average systolic reading by 3.2 points. A month later, readings were down 4.4 points. 9. Seek help for snoring. It's time to heed your partner's complaints and get that snoring checked out. Loud, incessant snores are one of the main symptoms of obstructive sleep apnea, OSA. University of Alabama researchers found that many sleep apnea sufferers also had high levels of aldosterone, a hormone that can boost blood pressure. In fact, it's estimated that half of all people with sleep apnea have high blood pressure. 10. Jump first point. A study from Circulation, Journal of the American Heart Association found for the first time that replacing some of the refined carbohydrates in your diet to achieve low blood pressure with foods high in soy or milk protein, such as low-fat dairy, can bring down systolic blood pressure if you have high